you know, I'm looking for a total of 4 folks who can do exactly what Norm did this morning, and I'll just organize it, at least 4. So if you're interested in doing that, just in the chat box, put you're interested in helping out with invocation, then I'll schedule you, and it's exactly what Norm did, to just share a Bible verse and talk about what it means to you. So we got a special day, Miss Vivian's birthday. So I think we should all sing Vivian a happy birthday. Happy birthday to you.
Happy
birthday
birthday
to you. Happy birthday,
Vivian.
Happy birthday
to you.
Many more.
Thank you. Thank you.
And it was Laurel's yesterday. I'm not going to let her escape.
Really?
Yes.
No wonder we're 2 peas in a pod.
That's right. The best compliment I've had all week. Thank you.
So also in the chat box, during the month of October, we're going to do the tuna can collections like we did 2 years ago. If your business or church, you want to just be the point of contact for tuna can collections, that'd be great. And then you can advertise it locally within your business or church. And then I will come by once a week during October to collect them and then turn them in to the food bank. So if you're interested in doing that, again, the chat box, just put your name and the business or church that you want to help out. And again, all you got to do is just advertise it, and I'll give you a box and come by and collect it. I was really, really pleased at our Jam in the Park. It was definitely all hands on deck. Everybody did a fantastic job helping out. It was really good to see so many folks out there helping out, and spectacular. Steve, and we want to thank you for organizing us and managing it. And it was job well done. We want to
anybody can do that, Scott. Come on.
Yeah, you did good, Steve. You did really good.
Yeah.
Thanks. Tomorrow we got hot dog sales. Bill, you want to talk about it?
Yes, tomorrow at the Dream Park, 3 to 5. You can volunteer about 2. And it should be pretty quick. It's what we had left over from jamming. So I think there's about 260 dogs. And we've got, leftover condiments and all that. So it's a good way to make a little extra money with this. And then after that, if anybody wants to buy any dogs or buns, we'll sell it that way, just so we make sure it goes somewhere, get some funds back. And so we're going to have hot dogs, a drink, and chips for $5, or just a hot dog for $4. So that really talks them into, I'll take the meal. That worked really good. Yeah. So you have the soda. Do you have the soda pop and water?
Chris has got it. So.
Oh, okay.
So along that lines, Chris is out of commission. It sprained his ankle. So hopefully I'll be able to borrow Kurt's trailer. And okay. I need somebody to help me load up the grill and all the sodas. I really need just one body. We'll meet at Chris's house at 12 noon. We'll load up the grill and the sodas, and then go. It'll give us plenty of time to get over to the park by 2. So I just need one body. So if you can help, just is there anybody out there who can help me? Meet me at Chris's house at 12 noon. Betty?
I can help at noon, but I can ask Gary Smith, who helped me with jamming, and he loaded up a lot of stuff for me, the food. So let me send him a text. And he has a trailer.
Yeah, if he could meet me at Chris's house with his trailer, that'd be great.
I'll text him this morning.
And we'll load everything up on his trailer, and I'll help offload.
Okay, I will text him right now.
Okay, great. Thanks.
Mm-hmm.
Vivian, quick question. Do you want the 5 bags of ice dumped out of the bags into the cooler? Are you going to use that for the water, or
use it for the water and the sodas?
Okay, so go ahead and dump them out of the bag before I get there.
No, don't, just keep them in the bags because we usually put the sodas in those big bins.
Okay, thank you.
Yeah, thank you.
So another announcement, 1 week from today, 9 a.m., we're going to do the tuna can trophy, gold trophy award picture at Pacific Office and Equipment, 9 a.m. Vivian, you're good with that yourself?
Yep.
So we need extra bodies. So if you want to, Chris has already confirmed he's the one receiving the trophy. But if you have time, just it'd be nice to have as many members there as possible. Happy bucket, whatever you want to give this morning, put it in the comments. Norm's, let me know. We have a lot of members who haven't paid their membership dues, so we're giving another week, and then I'll send out reminders after that. So want to keep the reminders as low as possible. So if you haven't paid, just kindly do it this week. And that was an email from Steve, and he's got everybody there. You just print up yours and send your check off. So just so in closing on opening remarks, my apologies this morning about the last minute change to Zoom only. We met as a board last Wednesday. I honestly didn't know what to do myself. I'm actually father-in-law. He's fully vaccinated, but he had a breakthrough. He's been hospitalized on oxygen. Then you hear horror stories about the hospital and running out of ICU beds, and short-term stays now being converted to ICU. So, and we went board member by board member. We were pretty much unanimous that we need to be setting the example ourselves to the community, and so all of us decided we're going to go to Zoom only and no longer hold the hybrid meetings. We will do this until we'll revisit it every board meeting to see if we go back to hybrid. But so for now, it's only Zoom. So it's the right thing to do. So any other announcements this morning?
Hey, Scott.
Yes, sir.
I just wanted to make an announcement that we do have Trent Pomeroy as a guest on the call again this morning. So
okay.
Welcome, Trent.
Good to have you, Trent. Any other announcements? I think Kathy, you want to announce something? You're on mute.
Scott, did you want to share about the branding grant?
Is your success. So you go ahead.
Well, no, it's a team here. So we are going to get a matching grant for some efforts we're going to take, and we passed a resolution at the board meeting that Norwester is spelled capital N-O-R apostrophe capital W-E-S-T-E-R. And we're going to take that information and look at all of our branded material. So if you see something that does not have that spelling, please let Laurel or Vivian or Carmen know. And then we're going to meet and look at all of our branded materials and how we use them and decide what we need to do to really elevate our face in the community. Looking at traditional things like banners and then more non-traditional approaches too. So this is a club project, and your group will be Vivian, Laurel, and Carmen, and I'll be kind of in the background. So it's a really nice opportunity. We could get back about, we get half back of what we spent. So if we go, say, buy banners and stuff, for $800, we'll get $400. So that's really exciting.
And Kathy, thanks for getting
start in a couple of weeks.
All that organized and happen and improve. That's hats off to you. Sure. Okay, I think any other announcements? No, I think we're good. So Laurel, Kathy, who's introducing Rebecca and team?
Well, I'm really happy to welcome back Wendy Sisk and her sidekick, Rebecca Miller. Rebecca actually brought this to Laurel's and my attention, and they're going to share today some proposals and plans for the Allview Motel to renovate, convert 27 rooms into low-income health low-income mental health housing for individuals. So I'm just going to let you take it from here. Rebecca, did you want to start it off, or Wendy?
Well, let me just say thank you for letting us come. There's been quite a bit of buzz in the neighborhood, and I just thought you might enjoy hearing it. Wendy and I each thought that the other person had the slideshow. I did manage to pull it up, so I'm going to try to on Wendy's cue. But Wendy has been at our agency for, I believe, 19 years, took over as CEO, I believe, about 5 years ago. She is a force to be reckoned with, and super proud to be working for her at the agency. So Wendy, I'll let you take it from here, and you can just kind of guide me through the PowerPoint. Let me know when you want me to pull it up.
Oh, you can go ahead and pull it up. So I met many of you. I see one of our esteemed board members, Grant Monroe, and some of our other supporters, Laurel and Norm Schaff, we know well, and Kathy, we've seen lots of you over time. I can't see all of you on my screen, but I've been with the agency for 19 years. I'm a licensed mental health counselor and a geriatric mental health specialist. And when I took over PBH as CEO 5 years ago, we had about 85 staff. And we've been serving this community since a local physician about 1971 decided that, boy, we sure need some mental health care in our community. So PBH has a mission of providing quality, comprehensive behavioral health services to the residents of our community. And by the numbers, Rebecca, we serve over 3,000 community members a year. We have about 170 full-time positions now, though we have about 20 openings. And our annual budget this year was $14.5 million. So we have a pretty big impact in our community. We'll move forward. All right, so last year, Rebecca said, hey, there's this grant opportunity. And I said, no, Washington's not eligible. And then in the end, it turned out Washington was going to be eligible. And Rebecca helped pull together a team that put together a $2 million grant application, $2 million for year one and $2 million for year two. And we were afforded the CCBHC grant, which is the Certified Community Behavioral Health Center grant from SAMHSA. So this enabled us to expand our services. Traditionally, we've provided counseling services and medication management services. We have a couple supported living houses and things like that. But this allowed us to add in primary care on site for those people who aren't accessing care elsewhere, supported housing services, supported employment services, care coordination. It allowed us to work more closely with other care team members in an individual's life. So if they're in primary care somewhere else, we can connect with them. We also increased our intensive services and our evidence-based care, like EMDR for trauma, which is this really cool voodoo-like move your eyes, and it helps you reprocess pathways in the brain to reduce the impact of trauma on your life. We have clinics in both Port Angeles and Sequim, and our Front Street office. And actually, we're in the process of buying a larger office in Sequim because our impact in Sequim has never been as great because we have a tiny little office that only has, I think, 5 functional offices. And we have 6 teams that rotate through that office. So we're looking at expanding our footprint in Sequim and being more accessible to the residents of Sequim. And we're going to move forward, Rebecca. And one of the things Rebecca and I have been talking a lot about is the kind of the history of mental health. And prior to the early 1960s, people with significant mental health issues lived in institutions in our nation and really across the world. And they weren't the best conditions. It's not somewhere you'd want one of your loved ones to be. And then in 1960, I can't read that slide yet, 1963, the Community Mental Health Act was passed and community mental health centers were formed across the nation. Now, these have never been well-funded community mental health centers, but that's what Peninsula Behavioral Health has traditionally been classified as, is a CMHC. Our job when we set out to become a community mental health center was to provide care to those people who were the most vulnerable, who had the most severe mental illness, And so we have done that throughout our tenure, but we've also expanded our care to people who are veterans, to anyone who truly needs help and doesn't know where to go, to people with substance use disorders as well as mental health. And we take all insurances, Medicare, Medicaid, and we even provide care to those who don't have the ability to pay. So if you're low income and you have a high deductible health plan, it's like having no insurance at all. So we make a lot of efforts to do fundraising to close those gaps. And our services are pretty extensive. We do the things you would normally think of in mental health: traditional counseling, therapy, psychiatric evaluation, medication services. We have a full service substance use disorder treatment program. I have wild cats running through my house. We provide 24-hour crisis intervention and mobile crisis outreach. And we have a team of, I think, 5 or 6 now staff doing homeless outreach services to try to connect with people who have mental health and substance use disorder treatment needs that might not otherwise connect with us. Last year, we had it in our strategic planning to pivot to telehealth, and we were able to do that really quickly. And so we have a strong history of being able to pick up a project and make it happen fast. So I don't know, Rebecca, was it maybe June or July? And Lindsay, I get his last name wrong every time, Schroman Morwin, I'm close, I know, called up Rebecca and said, hey, have you guys thought about the Allview Motel? So the Allview was for sale, and we kind of looked at it. It's only a half mile from our office. It's right next to the library. It's right next to SARS. And we thought, wow, that would be really cool. So I reached out to Commissioner Johnson and said, hey, Randy, is there any money out there, one-time money, maybe COVID money, that might help us, convert this motel into housing? And he pulled together a group of community leaders, particularly those who are involved in housing. So Housing Authority was at the table, Serenity House was at the table, PBH was at the table, Healthy Families was at the table, Kate Dexter, the mayor of Port Angeles, Nathan from the city manager in Port Angeles, Nathan West, Allison Brecky, and Barry Brzezowski from Squim. And we all collaboratively came together and took a look at this project and decided that A, it was feasible, and B, this would be a really easy way to turn a 20-unit motel into 27 units of affordable housing for people with mental health and substance use disorder treatment. So there was another agency that also had an idea of what to do with the motel, and they handed the project over to PBH, and then this grant opportunity popped up. So we had about a week and a half to put together a Department of Commerce Housing Trust Fund grant, and we applied for $2.1 million from Housing Trust Fund to help us renovate this motel, with a commitment of $675,000 split between the city and the county, showing that we had local match and local buy-in. We did not get that grant in phase 1. However, we were strongly encouraged to apply in phase 2, and our grant didn't pass because of a technicality. So the grant team has asked us if they can provide us some support, because they really want to see this happen. They're very excited about it. And I'm working currently with the county and the city about how do we continue to proceed forward with this project. There's a lot of enthusiasm. We all know that housing is an issue. And we know that sometimes people with mental health and substance use issues may be harder to house. If you have a choice as a landlord to rent to somebody who's disabled because of their mental illness, or somebody who's working full-time at Walmart, you might choose the person who has the full-time job over the person who has disability. So we're continuing to chip away at that. We have a lot of support throughout the community and within city and county government to make this project happen. We anticipate we're closing on the building at the end of October. And at that point, we'll be reapplying for phase 2 funding. And we will be asking for assistance to building kitchens into units. We will have 20 units that are studio units that do have a kitchen, do have a bathroom, and have laundry facilities on site. and 7 2-bedroom units for families. We'll have an on-site superintendent. We'll be wrapping services around everyone who's in this program, whether it's case management, care navigators, peer counselors, employment specialists, crisis services, so that we have the ability to respond to any issues that come up 24/7. So we're really excited about this opportunity. PBH has a long history of successfully housing individuals who have really significant needs. And we want to continue to build on that because we know that we're the provider in the community that has the skills to truly support individuals who have more challenges. So we're working with Peninsula Housing Authority. They've contracted with us on this project to help us get this set up and running. And so we're really excited to meet with the community, talk to folks, answer questions. I've gotten a lot of questions about, you're going to site this next to a school? And I say yes, because we're going to have children living in this facility. So we treat people who have ADHD and depression and anxiety and schizophrenia and bipolar disorder. So there's a large scope of people that we provide care for. It's our intention that this will be dry housing, that we're going to ask people not to be bringing substances on site to the housing. Because I also hear a lot of concerns about, we don't want another wet housing project that doesn't have adequate supports in place. So we're trying to be really thoughtful about how to make this work and how to support people. 4 of the units will be set aside to support mental health court because we've been working with the county to bring mental health court into fruition for a number of years. And that looks like it's happening by the end of this year. So we're really excited that this project will help us not only house up to 40 plus people who are currently homeless in our community, but also allow for some transition for folks who need a little extra support on their way to other independent housing. What else, Rebecca?
Well, I just wanted to clarify when Wendy said that we didn't get it in phase 1 because of technicality, that might be perceived as like, we forgot to check a box or something like that.
No,
and it wasn't that.
The Allview is going to require some significant renovation, and their phase 1 projects, they really wanted them to be turnkey, no renovation required. And so their phase 2 grants, which they did not spend any of their rural dollars. So they had 21 million set aside for rural projects. There were no rural projects funded out of this money. So that moves into phase 2. So we feel strongly that we will be getting that phase 2, Lenny, which allows for renovation because it's an old building. It was built in the 1930s and it needs a little love in places. The current owner has done a really great job. It's in pretty good shape, but there are still some things that are going to need to be addressed. And just adding kitchens and refreshing the bathrooms is going to be substantive. So we're really excited about this opportunity. I feel like we've got strong support both from the state and our local officials and our community. And each time that I've talked to somebody who has had concerns, we've really been able to allay their concerns. I read all the things that people wrote on PDN, Facebook about this project. Oh, they're going to put a bunch of pedophiles next to the school. Well, no, that's not a condition that we treat. And no, who would do that? We're not, it's pretty ridiculous. But what we are going to do is we are going to support people who otherwise might have challenges with housing, learn to be successful so that they can return to work, so that they can live a full and independent life. So we're really excited about this opportunity, and we're really excited by how much support we've seen in the community. There have been a couple of folks who've taken the time to call me and share their concerns. And at each juncture, we've really come to a place where that person's supportive of the project. So I'm excited that we're touching base with all sorts of neighbors and businesses in the community to ensure that we're all on the same page.
Yeah, I really wanted to harken back. We always, Wendy and I talked about the black and white pictures that are really disturbing to see in the old institutions. If when those institutions closed, if these kinds of programs had been put in place with the community mental health centers, we would probably not have the same problems that we have today. Instead of just putting people out in the street, we needed to have sheltered them and given them these kinds of supports. And so I feel like, with community mental health having been underfunded for so long, it's time we really do have to make these investments, because some people simply cannot survive without support. And sometimes outpatient isn't enough. And I think that's one of the main reasons that we really wanted to beef up our residential program.
We know that, Kathy, go ahead.
My question is this considered definitely a safe place, but is it considered transition or temporary, or I'm not
Great
sure
question.
Where it begins and starts?
So we'll have 4 units of transitional housing, and we'll have 23 units of permanent supported housing, meaning that people can stay in those units even if their income rises above allowable income levels. There's the ability for those people to stay in those units long term. So what we don't want, people send me apartment complexes all the time. And I say, that doesn't fix any of our problem. That's not adding housing stock. If we take over an apartment building, we're going to be displacing a whole bunch of folks. But by converting a motel, there are 2 residents currently at the motel. One of them's been there for about a month, and one of them's been there for about a year. And if they don't qualify for this housing, we will be working with them to find alternatives. But they're not currently in housing. They're currently homeless because they're living in a motel. So, my hope is that we'll be able to find a way to make sure that those individuals aren't displaced in the community as well during this process, because it doesn't do us any good to buy an apartment building and kick everybody out just so we can put somebody else in. And, to Rebecca's point, I've also heard a lot of, well, these people just belong in institutions. And I think that there's a misconception about A, who PBH serves, and B, what that means and what the cost of the community would be. So one month at our state psychiatric hospital costs over $16,000 a month per individual. Now, if we spent a fraction of that providing the appropriate supports in the community, that would be really helpful. But we don't as a state. Washington State is ranked number 43 in the US in how we fund our mental health system. 42 other states fund their mental health system better than we do. And fortunately, we're not number 50, but 43 is pretty bad. And so we're continuing to work with our legislature. We're advocating at both the federal and the state level to create a new model of funding for behavioral health that's being shown to be effective across the nation. When we got our CCBHC demonstration grant from SAMHSA for $4 million for 2 years, that's great. But what happens after 2 years? So we're talking with the state about how do we move forward and figure out a new funding model for mental health that actually provides adequate resources. I always say that we're a part of the backbone of the healthcare system, especially right now. With COVID, we've had a substantive increase in the number of people asking for help. And it's really hard for us to keep up, and we can't compete salary and benefits wise. Of that $14.5 million budget, but 86% of that goes directly into staff salaries and benefits. So our staff are our primary resource. So we're working really hard to try to convince the legislature that if we're part of that infrastructure, you would never let I-5 be a dirt road with potholes, but that's how you funded behavioral health. So Rebecca does a really great job helping us fill those gaps, because sometimes, the dollars that come into us are typically treatment dollars, and they can only be used for very prescribed things. But sometimes people have needs outside of that set. And so we see that with housing. Right now, there's a lot of resources to help people with housing if you can find it. Anybody look for a rental recently? Your 2 bedrooms are starting somewhere between $1,200 and $1,500 a month in our community right now. I was at the Sequim Realtors Association recently, and I was told that the average home price in Sequim, I can't remember if he said it was $540,000 or $560,000. But, the home prices have gone up tremendously. We have about 900 Airbnbs in Clallam County, which sounds like a lot for a community of our size. And a lot of those were homes that used to be rentals for people in the community. So from a workforce standpoint, we can't find rentals for our staff either. So I'm not sure how we can not work on affordable housing as a community, as a region. We're also working with Commissioner Johnson on looking at, there's a there's a potential 0.1% tax that the county could pass for affordable housing. And we're talking about whether or not the county would do that. And if they did, what would that look like? But we have a serious housing crisis across the spectrum. So we have a lot of high-end single-family homes being built and very little affordable or multifamily homes being built. So we're really excited to be able to partner with Peninsula Housing Authority to make this happen. I don't think PBH is ever going to become a housing agency, but there's a subset of the population that we're really good at supporting to help them become more independent. And that's where our role fits right now. What else, Rebecca?
Well, I don't know. I don't know if there's more questions, but Laurel actually asked me a question last Saturday at Jammin' because she thought I was, Mark Nichols was our guest a couple of weeks ago. And Laurel thought I was being a little too obtuse about what I thought about House Bill 1310. He had sort of described an incident that happened right outside as Wendy and I were looking, up on the second floor. We watched it unravel all 4 hours. And so can I just to jog everybody, House Bill 1310, which went into effect just in July.
July 25th.
It means that the police force will no longer transport people who have been involuntarily committed. And so it just happened. It was a brand new bill. Sorry, I got kind of caught off guard because my dog jumped up on the counter. So I'm going to let Wendy.
House Bill 1310 was the big police use of force bill. And it really limited when officers could put hands on an individual. And basically what the bill says is that they can't put hands on essentially unless they're arresting someone. And what that means for us in our law, which is RCW 17105 that governs involuntary psychiatric commitment, it tells us you mental health person, you make the decision about whether or not this person needs to be committed. And then you call a peace officer and he will take that person into custody and force them to go to the hospital. Well, 1310 says you can't put your hands on someone unless they have committed a crime. So what happened at our office was we had an individual who was having a first psychotic episode. So he was hallucinating, he was paranoid, he was wandering. Somehow paramedic Dan Montana got him to come to our office voluntarily. He was evaluated. They determined he needed to go to the hospital. And we had about 20 first responders on scene for about 4 hours. So we had Olympic ambulance and we had PA fire and we had PA fire community paramedicine and we had Chief Brian Smith and a number of police officers. And they waited until this individual committed a crime, which was grabbing a necklace off somebody walking by. And the intent was to take him to jail at that point. We worked with PAPD. We ended up psychiatrically hospitalizing. But what that means for us is when we have somebody who has such a serious need that they can't take care of themselves, that they're unsafe to be in the community, we now no longer have the ability to forcibly take that person into custody and get them the treatment that they need. And sometimes we have to walk away from a situation even after we've made an involuntary commitment determination because we're not allowed to put hands on. And law enforcement believes they're not allowed to put hands on. And fire is not going to put hands on. And Olympic ambulance is not going to put hands on. And so it's really left us in a lurch where we're trying to be supportive of our local law enforcement, but at the same time, we're not able to effectively do our jobs. And it's heartbreaking. And that day I called Mike Chapman, said, do you know what's happening in your backyard? And I called Steve Behringer and I called Kevin Vandeweghe. And, I spoke with all of our legislators. I reached out to the governor's office. I reached out to the attorney general's office. I reached out to healthcare authorities. So we're doing a lot of advocacy around this, but it's really going to require a legislative fix. The Washington Police WASPIC, the Washington Sheriffs and Police Chiefs Association, has determined that that officers should not be intervening in these cases. and only recently determined that, yes, they should at least still respond. So I was on a call yesterday with a colleague in Pierce County, and they had a crisis responder who went out to a case, and these things don't happen often, but they do happen. And the individual attempted to set fire to the crisis responder, and law enforcement refused to respond because they didn't see it themselves. So our law enforcement would never respond in that way. They're still by our side. They would protect us in the event that, something scary were to happen. But we're really struggling to help affect change for people who are really quite ill, and don't have the capacity to make that determination for themselves. So there's a lot of really challenging things happening in the mental health world right now. And on top of that, we have a really profound workforce shortage, about a 1.4 million behavioral health provider shortage across the nation right now. So it's been very difficult for us to recruit and retain staff, especially when folks are working so very hard right now. What else, Ms. Miller? Or are there questions from the group?
We're good, about 10 minutes. So
I've got a question to circle back to the Allview Hotel.
Mm-hmm.
My question is I support housing these folks, and I think it's needed. And my concern doesn't really stand too much with the individuals living there, but the people but their visitors and their guests. And I believe that with most of the housing that PBH does, it's more hotel style, where there's somebody that can sit at a front desk and kind of monitor. No. What about the building over on the west side by Safeway?
So
that's the part that concerns me about it being next to a school, is who's coming in and out, not who's living there.
Well, I'll tell you, there's an apartment building right next door, and we don't know who's coming in and out, but we also know that nobody's monitoring that at all. So in our housing, so right now we have 3 houses and we have 1 assisted living. So the assisted living is staffed 24/7, and the 3 supported living houses, our staff are in and out of, throughout the business day. We try to make an appearance at each of our houses every day. So we will have an on-site resident manager at the Allview. And so 1 unit will be dedicated for that resident manager. That person will have mental health first aid training and crisis prevention institute training. And we will have that person, designated as, if it looks like things are going south in whatever sort of way, that person will know how to get the treatment team engaged and involved. So, and again, we do have staff on 24/7. That person, our hope is also to find somebody who can do some, basic maintenance things like turn off the water if there's a leak until our maintenance team can get in there. So we don't, these people live in our community now, and there are lots of folks who live, again, in apartment complexes nearby, and nobody's monitoring comings and goings. And to some extent, we won't have the ability to always monitor comings and goings, just like any other apartment complex, right? People have rights, landlord-tenant rights. Mm-hmm. However, part of our agreement with folks coming into housing is that, yes, you will let our treatment team in, that yes, you will be actively participating in treatment. So our clients are no more or less likely to have unsavory people in their lives than the average person. So, people with mental health conditions are more likely to be victims of crimes, which is why we also intend to do a lot of coaching around how do you successfully live independently and how do you protect yourself from people who are trying to take advantage of you and those sorts of things. But there's always risk, right? I mean, we can't tell people you can't have visitors. What we can do is use the housing authority model of, limiting the time the visitors can be there so that people don't just become a flop house. And have people staying with them all the time.
Hey, Tyler, I wanted to say too that one of the things with PBH is we've got case management, and it's not like case management that Serenity House performs. When they talk about case management, they're really just talking about how to get people to fill out paperwork and help them through the system. The clients, or residents, I should say, because they're just going to be residents of our community, they will be offered services through our case management, which is social work, so that they are, like Wendy said, they're going to be coached. They're going to be, services available for them on developing life skills. So I hope that puts your mind at ease. We just want these people to be a part of the, to be a part of the neighborhood.
Scott, I think you started to say something a few minutes ago.
Sorry, no, I was just saying that we had like 10 minutes left to see if there are any other questions. So,
I would like to make a remark. I want to let both of you know, Wendy and Rebecca, that I really, really appreciate the hard work that you and your teams put in every day on behalf of our community. I think lately in the current atmosphere, some people are having a hard time distinguishing between unwell and bad. And I think that your efforts making that distinction easier for those of us who aren't mental health professionals. And I also very much appreciate the explanation that Rachel gave, because Rebecca, because I found that whole law thing really confusing. And it's not that you were obtuse, Rebecca, it was that I wasn't getting it. So I guess that makes me obtuse.
Laurel, it took me a few meetings to get it too, for the reality and the gravity of the shift in that law to set in. So thank you for that. Our staff have worked really hard. Doctors and nurses get a lot of shout outs, teachers get a lot of shout outs, and behavioral health professionals just keep working behind the scenes, quietly doing really good work, treating people with a lot of really complex needs. And then on top of that, we've seen just a lot of average people who maybe don't have a diagnosable mental health condition, but reaching out to crisis services, just needing a little extra support. It's been a tough year and a half. And, we never sent our staff home. We've been in the office since day one of the pandemic. And, folks are tired. It's been tough, and they've been through a lot of change, but they still continue to do really incredible work and really want to be there for our community despite all the challenges.
Can I just give a shout out also to Steve Lewis's fiance, who we are lucky enough to have, Jesse, down, one of our medical assistants. So it's good to see you this morning, Steve.
Well, thank you, Rebecca.
Well, I'd like to take the last couple minutes. Oh, sorry.
Sorry, Scott. I just was wondering, I know that you have arms, fingers, and legs and so many other entities in our community, which I think is wonderful. But how do you see this working with the Rediscovery program?
So Rediscovery and our PATH team work really closely together. So our PATH is our homeless outreach team, the program for something homeless. So I should know these things, but there's too many acronyms in my world. So we work really closely with them. So our PATH team with the Rediscovery team, I think, will generate some of the referrals for the individuals who will end up being housed in this. So we are hoping to be at fully occupied no later than March. So this is a really rapid turnaround. It's required of the grant. We have a contractor in place who's willing and able to do the work in a really timely fashion. So, we're really excited to move that forward. But Rediscovery and our PATH team will be working with our case management team to generate the referrals of who are the folks that are going to be housed here, as well as the North Olympic Veterans Network in Forks has several vets that they'd like to refer. So we're working with all of those community partners. These aren't necessarily all going to be people who are currently active with PBH. They may be engaged in other mental health services like with the VA. So, and then we'll just coordinate with their treatment team at the VA and wrap the extra services that are necessary around those folks.
That's great, because Cheryl's part of our group, and I was kind of thinking you answered my question before I asked it.
Yep.
So I'd like to take the last couple minutes here and turn it over to Carmen for possible tying with you all on the PBH, Wendy and Rebecca. So Carmen, take it away.
Great. Thank you, Scott. And thank you, Wendy and Rebecca, for a great presentation. I learned a lot about the Allview program. So thank you. As Nor'wester Rotary members, this year we are focused on community service projects, giving back to the community and helping build our community. Each quarter, we're picking a theme around mental health, youth, the elderly, and homelessness. And so we think that, the Allview would be a great partnership in regards to homelessness, to ending homelessness and getting people on the right path. So we don't have to answer this now, but if we could just think about ways that that Nor'wester Rotary can help support this project, whether it's helping, rebuild a kitchen or whatever you foresee, I don't know if you have any ideas right off the top of mind, but we would love to partner with you guys.
That's great. Thank you, Carmen. We'll ponder that.
Awesome.
Yeah, so I'll be in Miami next week, but maybe the week after. And Carmen's very busy as well at the school district there, but maybe the week after next, or we could all meet. And I know Rebecca, you and I have been sharing ideas as well on maybe other projects that y'all are involved with. So
thank you so much.
So we'll all meet up and maybe the week after next winter. We'll figure that out later. Well, Wendy and Rebecca, we appreciate your presentation very much, and you're doing great things in our community, which is very much appreciated and very professionally run, and we appreciate it. So thank you, everybody. Hope you have a good weekend. Again, friendly reminder, tomorrow, 2:00 at the selling hot dogs. If you can lend a hand, that'd be great. So hope you all have a great weekend.